What I want to talk about today is something that's not common knowledge. It should be, but it's not taught to us. The only way you learn it is by asking yourself why. Well, why did that happen? Why is this like this? Why is this patient looking like this? And it just so happens that my training is a series of coincidences that lead me to understanding this and knowing this and then making a better choice for you. So here's a patient, comes into an orthodontic office. Oftentimes he's a thumb sucker. Okay, so what is the misdiagnosis? Well, why is he thumb sucking? So the biggest reason we suck our thumb is that it's a sensation. The tongue is supposed to be working up in the roof of the mouth, but if it can't, if it's not trained, if we miss a critical period in development, it stays arrested in development, it stays working down low. And I believe there's a critical period in neurological development. In our brain, when we're younger, we have critical periods of neurological development. So for instance, when you go to your pediatrician, they will ask you, well, did your baby sit up by 6 months of age? Did they crawl by 10 to 12 months of age? Do they walk by 14 months of age? These are critical periods in neurological development. So pediatricians know that, but they don't know there's one for the tongue. That tongue is supposed to elevate into the roof of the mouth. It is not supposed to be on the lower floor of the mouth and in between the mouth. So if it sits low and we're short lingual freedom or tongue-tied, there's a sensation in the brain saying, lift your tongue up, grow your body, you gotta start doing it. And it usually starts around 6 months of age. When you go to the pediatrician, they'll tell you to start feeding solids around 6 months of age, but they don't know about the critical period in development. They just feel it's the GI tract starts to develop enzymes and it's safe to start feeding solids at that time, but they don't realize there's one also for the tongue. The tongue is what actually forms the bolus so you can swallow food properly. So back to this, if the tongue sits low, your brain is saying, lift your tongue up, but you can't do it. So what goes up there? A nice little thumb goes up there, or 2 fingers. Sometimes it's a pacifier, sometimes it's a bottle, but it's always a sucking habit that quells the brain screaming at you, lift your tongue up. A lot of times, really, really important for thumb suckers and finger suckers. They are ridiculed, their parents ridicule them, their friends ridicule them, but what happens is that if the freedom under the tongue is short and they can't elevate it properly, they just have a physiological sensation. They can't help it, they're not responsible for it, they're not weak, they're not mentally challenged in any way. They can't lift their tongue up, and so the brain is screaming, put your finger in there, so it feels good to put the finger in there. And it pushes against the palate and it quells the brain screaming at them, lift your tongue up. But look what happens here. So the thumb sucking then causes all this damage. In this patient, the thumb sucking caused this huge open bite. You can almost see where the thumb can fit in there. And it caused a bilateral, so both sides of a crossbite, which then causes all this formational issue, which usually causes the teeth all to back up. It's like a plane landing and it can't land because there's 5 other planes there. We don't have space for our teeth to land. So that's when you recreate the growth. You have to simulate growth for the body that the body's not getting on its own, and why it's so critical to see the orthodontist early on. Now, let's talk about this. Most orthodontists aren't equipped or prepared to deal with young kids. It takes a very special orthodontist with special training that has this ability to work with young kids. So my background, I came from a pedo office, all kids, that's all. And none of the other doctors wanted to work with the kids, and I did, I loved it. Coincidentally at home, I had a special needs daughter who taught me how to handle the most apprehensive, sensitive child available. So she taught me so I could be better at work. And being better at work helped me with her at home. So it was a win-win situation for everyone.